Good afternoon, everyone. Bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de cette séance. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser une question. Today, we will be hearing remarks from Councillor Keith Egli, Chair, Ottawa Public Health Board, le conseiller Keith Egli, président du Conseil de santé d'Ottawa, followed by Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique, and Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection et d'Urgence. Available for questions from the media following the statements, we also have, disponible pour répondre aux questions des médias, nous accueillons aussi Dan Chenier, General Manager, Cultural and Facility Services, Directeur Général des loisirs, de la culture et des installations, and Donna Gray, General Manager, Community and Social Services, Directrice Générale des services sociaux et communautaires. After we hear from the panelists, we will take questions from the media. We will now begin with remarks by Councillor Keith Egli, Chair, Ottawa Public Health Board. Le conseiller Keith Egli, président du Conseil de santé d'Ottawa.
Thank you, Kina. Hello, bonjour, Kwe. Thank you for joining us today for an update on COVID-19 in Ottawa. I'd also like to take a few moments to recognize that February is Black History Month, a month where we celebrate the legacy of Black Canadians, past and present, who have and continue to enrich our community and our country. This year's theme for Black History Month is "The Future is Now," and it is a great opportunity to celebrate and acknowledge the transformative work the Black Canadians are doing in Ottawa. As we look towards the future, I think it is also important to take this time to learn about anti-Black racism in Canada and identify what we can do individually and collectively to address all forms of inequality and oppression. Anti-Black racism and racism against racialized populations makes our population less healthy. At Ottawa Public Health, we have a responsibility not only to control infectious diseases such as COVID-19, but also to promote the health of the population by working with others to ensure fair opportunities for health. In 2020, our Board of Health formally recognized racism as a public health issue. There is no debate. The data shows that racism, discrimination, and stigma are associated with poorer physical, mental, and emotional health, and greater mortality. Anti-Black racism and racism against racialized populations is a significant public health issue, one that we all must work together to address. Our experience with COVID-19 has uncovered many inequalities in our society, which have only been made worse because of the pandemic. At OPH, we recognized early in the pandemic our own gaps, the need for better data to understand how racism is affecting people's health. We're also committed to providing and encouraging employee participation in anti-Black racism and other anti-racism training to contribute to improved health outcomes to better serve residents. At the end of last year, we also published a report on the mental health of Ottawa's Black community. This report is available on the OPH website. I encourage us all to take action by learning more about what is happening in our community and about how racism affects the health of our population. There are many community events taking place in recognition of Black History Month. Take advantage of these opportunities to learn more about the important work being done by members of your community. Speak to your children about racism. Speak out when you see racism happening and recognize when even you yourself might be guilty of stereotyping or bias. When we have privilege, we need to grow the opportunities for people who have less and ensure voices of people with less advantage are heard. Racism is a public health issue, and Ottawa is not immune. As you will hear from Dr. Etches shortly, through our collective actions, we have been successful in reducing the number of COVID-19 infections in the community in the past few weeks. However, the virus is still very much here, and we are asking residents to remain vigilant. As schools are back to in-person learning, some families may be picking up children from school, childcare, or the bus stop. It's important for families to remember that Ontario is still under a stay-at-home order. This means that travel to and from school is considered an essential trip. Additional stops along the way, however, should only be made if they are essential, like groceries or for medical care. If possible, make those essential trips when your children are not with you. Please remember to continue practicing public health measures such as physical distancing and mask wearing. Whenever interacting with those outside of your household, individual actions matter. I'd now like to invite Dr. Etches to provide her update. Thank you and merci.
Thank you, Chair Aglai, and hello, bonjour, Kwe Inge. We do continue to see encouraging indicators that the current public health measures are working to decrease COVID-19 in our community. You've heard us say this many times, that we've done it before and we can do it again. So I look forward to being able to say that we have indeed done it again, managed to decrease COVID-19 levels low enough to be able to return to services being more available. I want to make this abundantly clear. Opening schools does not mean we are home free or that we're ready to ease up on all of the public health measures and provincial restrictions currently in place. We need to continue to reduce transmission in the community as the lower levels make outbreaks less likely and many workplaces are currently affected. Je veux être très clair. La réouverture des écoles ne veut pas dire que tout va bien, que nous sommes prêts à mettre fin aux autres mesures de santé publique ou les restrictions provinciales en place. Nous devons continuer à réduire la transmission du virus dans la communauté, car des niveaux plus bas réduisent les risques d'éclosion et de nombreux lieux de travail sont actuellement touchés. Il faut donc toujours rester chez soi, sauf les étudiants qui vont à l'école, un service essentiel pour eux. So in other words, this is still stay at home, except for students to attend school, which is an essential service to them. We know these last several weeks have been particularly challenging, and I want parents to know you don't have to parent without support, and there are resources available to help parents. Please visit our Supporting Schools During COVID-19 page and our Parenting in Ottawa website for more information. Je veux que les parents sachent qu'ils ne sont pas seuls et qu'il existe des ressources pour vous appuyer. Visitez nos pages web Soutenir les écoles et ressources pour les parents pour plus d'informations. I want to thank parents for getting back into the habit of daily screening of children for symptoms of COVID before they go to school. And if your child meets the criteria, seek testing right away and ensure that every member of the household stays home and self-isolates while waiting for those results. And again, the turnaround times are very rapid these days. We will continue to work with our partners to offer on-site testing at schools, particularly to improve access to testing where there are a large number of high-risk contacts, as well as when we're seeking more information about potential transmission in a school. We're looking for additional ways to use rapid testing in the student population as we trialed last weekend prior to schools opening. Nous continuons à explorer des façons de mobiliser les tests de dépistage rapides pour la population étudiante, comme nous l'avons testé la fin de semaine dernière. Bien sûr, le dépistage n'est qu'un des outils pour limiter la transmission de la COVID-19. Les mesures de base de limiter nos contacts étroits aux personnes avec lesquelles nous vivons, rester à 2 mètres des autres, porter un masque et se laver les mains font partie de la routine quotidienne importante pour prévenir la propagation du virus. So the basics of limiting our close contacts to the people we live with, staying 2 meters apart from anyone outside our household, including before and after school, wearing a mask and washing hands often are the routine behaviors that will help limit the spread of COVID-19 and its variants. Today, Ottawa Public Health published a special report on COVID-19 in schools, and this report can now be found on ottawapublichealth.ca under our supplemental report section. It found that while limited transmission of COVID-19 occurred within schools, it peaked in early October and declined thereafter. The report shows that the vast majority, 85%, of those who tested positive got their infection outside of school. And of the 55 outbreaks that were identified in schools, more than half involved only 2 people. So the data in this report, in addition to the negative mental health impacts of school closures on our entire community, supports the decision to reopen schools in Ottawa. Les données de ce rapport indiquent que les répercussions négatives sur la santé mentale de la fermeture des écoles sur l'ensemble de notre communauté appuient leur réouverture à Ottawa cette semaine. I'm going to change subjects just to talk about seeking medical care when you need it. Our hospital partners have highlighted that older adults who test positive for COVID-19 are sometimes waiting too long before going to the emergency department, and this can lead to more severe illness and death. If you have COVID-19 symptoms, please get tested. And if you have symptoms of COVID-19 and you're concerned you might need more than just a swab, please consider making an appointment for a physician care visit at one of Ottawa's 4 care clinics. Si vous présentez des symptômes de la COVID-19 et croyez avoir besoin de plus qu'un simple test de dépistage, je vous invite à prendre rendez-vous avec un médecin dans l'une des 4 cliniques de soins d'Ottawa. At a COVID-19 care and testing center, you can see a physician and, if medically appropriate, get the following tests: a chest x-ray, an ECG, basic blood work, throat culture, and the COVID testing. So again, if you are in distress, like you have significant trouble breathing, chest pain, fainting, or you have a significant worsening of any chronic disease symptoms, do not go to a COVID-19 assessment center or a COVID-19 care and testing center. Call 911 or go to the nearest emergency department. For locations and hours of the COVID-19 assessment centers and COVID-19 care and testing centers, please visit our website. Healthcare providers have also noted that fewer people are going to their medical appointments or seeking medical help out of concern of getting COVID-19. So even during a pandemic, one thing that should not change is seeking medical care when needed. There are infection prevention and control measures in place, and waiting too long to get medical help can have serious consequences. Take care of yourselves and look out for one another. Même pendant la pandémie, il est important de consulter un médecin et d'accéder aux soins médicaux que vous avez besoin. Attendre trop longtemps peut avoir de graves conséquences. Prenez soin de vous et veillez les uns sur les autres. Thank you. Merci, Miigwech.
Thank you very much, Dr. Etches. We will now hear from Anthony DiMonte.
Good afternoon, everyone. Bon après-midi tout le monde. As you may recall, COVID-19 vaccines were first administered at long-term care homes in Ottawa on January 5th, the day after Pfizer vaccine was approved to be transported from the Ottawa hospital. 11 days later, first doses were completed in all 28 long-term care homes in the city, 20 with the assistance of the city's mobile vaccination teams, which includes Ottawa paramedics and Ottawa Public Health staff. Now, I'm pleased to advise you that the community continues to make progress in administering the second and final dose of vaccine to these high-risk residents living in long-term care. Notre communauté poursuit l'administration de la deuxième et dernière dose de vaccin aux résidents des foyers de soins de longue durée. To date, residents in 12 long-term care homes have been offered their second dose of vaccines. Of these homes, 6 required the assistance from the city's mobile vaccination teams, whereas the remainder were able to be immunized residents within their own medical staff. À ce jour, les résidents de 12 foyers de soins de longue durée ont reçu la deuxième dose du vaccin. I'd like to take this opportunity to thank the members of our mobile vaccination teams, our paramedics, our public health staff, and the long-term care home employees for their incredible work and continued dedication and service to our community. Je veux remercier pour votre travail incroyable, de votre dévouement continu, des services que vous offrez à la communauté. The 16 remaining long-term care homes will receive their second doses on a priority basis established by the ethical framework for prioritization of the COVID-19 vaccination. Completion of second doses in long-term care homes and our ability to reach residents in the high-risk retirement homes and other congregate settings, serving seniors will depend on additional vaccine supply. La disponibilité de la vaccination dépend de la disponibilité des vaccins. The province is continuing to assess the remaining stock of vaccines available across Ontario and is monitoring the requirements for the second doses against what the federal government expects to receive from pharmaceutical companies in the short term. Although we expect Ottawa might receive some additional vaccine supply later this week, it is important that everyone, including those fully vaccinated in long-term care and those caring for them, continue to practice public health measures to help stop the spread of COVID-19. Il est important que tout le monde de mettre en pratique les mesures de santé publique pour aider à enrayer la propagation de la COVID-19. Please also continue to maintain physical distancing requirements while outdoors. That means maintaining at least 2 meters distance from anyone outside your household at all times. Bylaw and regulatory services will continue to monitor for compliance, so please remember to wear your mask and enjoy the outdoors safely. Comme les services de règlement municipaux continuent de surveiller les règles et le respect de ces règles, n'oubliez pas de porter un masque pour profiter du plein air en toute sécurité. I also want to mention the current COVID-19 outbreak in Ottawa's shelter system. This outbreak has resulted in 4 emergency housing shelters accepting a limited number of new clients. This, of course, is concerning, especially with the cold weather we've been dealing with lately. However, we've been planning for outbreaks in congregate settings since the beginning of the pandemic. In advance of the winter months, the city's cold weather response plan included specific actions to address public health guidelines. This is part of our broader emergency response to support residents who are experiencing homelessness during the COVID-19 pandemic. While we've been working with our partners and have set up respite centers where the most vulnerable residents can warm up, get some food, and connect to other support services, we are currently adjusting our plans based on the needs, and we're prepared to increase capacity. I also want to remind everyone that people who are in urgent need of shelter can call 311 for assistance, where the city can assess their needs and provide support accordingly. We will continue to work with our partners on this situation. Again, I want to reiterate that although our numbers are heading in the right direction, we can't afford to lower our guard. Our individual actions matter. Let's continue to work together to keep our community and our residents safe and healthy. Thank you very much. Merci beaucoup.
Thank you very much, Mr. Dimonte. I will now invite questions from each agency alphabetically. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. So we will now go to CBC Ottawa.
Hi, I just wanted to follow up on the plan for people who are experiencing homelessness. So does that mean that you're going to be opening the shelters up again with more space, or are there going to be other areas where you're going to be able to open up where people are going to be able to spend time overnight, or what's the plan there?
So we're fortunate to have my colleague, Donna Gray, who has a responsibility, and her team have been working on this. So perhaps I'll let her answer that question to give you more detail. Thank you.
Thanks so much, and happy to take the question. So what we have done as the total response is to take a look at the need and have kind of a variety of different places that are available for people for temporary housing, depending on what their need is and what their situation. And that's a combination of shelter, additional like physical distancing should somebody need a space that has not been in the current shelter system already. It includes hotels and motels if people have specific needs that are unique to them, family spaces in hotels, depending if it's a family situation. So what we do is, through the process, is we want to make sure that when we're doing the referral process, we're minimizing any impact of anybody entering into a sheltering situation of exposure to COVID. So we want to make sure that as we go through that process and we're assessing each individual case, that we're appropriately placing people in this situation that meets and reflects their needs. And so we use all the options that we have available in a variety of different spaces to accommodate that excess need, to make sure that people have the supports that they need while they're in a precarious housing situation, and that we make sure that we're, accurately reflecting their needs.
Thank you. And I'm just going to switch gears for my follow-up. I just wanted to ask a question about the report that Dr. Etches mentioned. Can you just tell us a little bit about why the spread is less in schools? And even though, kids are probably close together and playing together, that is not, COVID-19 isn't having a large transmission in schools?
Thank you for the question. What we see the greatest risk for transmission where that occurs is when there's close contact for a longer period of time without masks and without distance. And so households, for everyone in our house, unfortunately, is where we're most likely to have that prolonged contact without the protections. And so it's the same for children. That household is where they're most likely to be exposed. The schools have different levels of protection that first of all aim to keep COVID out through the screening that parents and staff and teachers do every day to assess whether they have symptoms, and if they do, to make sure it's not COVID, to stay home until that's clear. The mask wearing would help. So does any distance that can be put between students, and the cohorting is what helped us to limit the transmission to, if there is someone who tests positive, that it we don't see it typically affecting the whole school. It's that one cohort where that person is, or the people in close contact there that need to isolate for 14 days at home, and that limits further ongoing transmission. So there are a number of measures like that we just don't see in the home environment or the social environment. So it just means that the rates of transmission appear to be lower in schools.
Thank you very much. We will now be going to Ted Raymond at CTV Ottawa.
Hi, good afternoon. Thanks for taking my question. My first question, I guess, is for Dr. Etches. Realistically, in your opinion, when does Ottawa Public Health foresee any kind of return to, I guess, like a pre-pandemic life in the city? And what do you think that would look like? When can we expect to get COVID cases and vaccinations to a point where some of these measures that we've been doing for this long aren't going to be necessary anymore?
Wow, that's the real end point for sure. We're all aiming for that eventually, where we don't have to wear the masks and we can visit with whoever we want to visit with and hug people. And that is harder for me to predict exactly. I think first sort of milestone we want to get to is back to where we were living with COVID in the community, with schools open, with businesses open. We were using those tools that work, the mask use, the distance, the limiting our contacts. That's a first step. So that's what we're trying to get to next. I think that we can get there soon if we continue this downward trend. And the vaccination will eventually make a difference, but it won't make a difference quickly. So, in terms of, I realistically, I need to help all of us, continue to be up to and maintain that routine behavior of mask wearing, et cetera, probably through into the summer. The government is talking about the supply of vaccines really increasing over time to a point where in September, anybody who wants one will be able to have one. And so, I think we are monitoring this. If we get our most vulnerable populations for hospitalizations protected, and we see that the hospitals are fine and we can tolerate, opening things more and more, we will let you know as soon as possible. But it requires some evaluation to really understand how much protection is provided from that vaccine. We are looking around the world to see what are those thresholds. What's happening in Israel? At what level do we see that there's ability to ease up on some public health measures? So I know that isn't a specific date, but I guess it's pointing to a first step and then some months of maintaining what works to keep COVID manageable, and then ongoing evaluation.
All right, thank you. And for my follow-up, this is also for you, Dr. Etches, with schools coming back this week. And I know you sort of addressed this in your opening remarks about starting to open things back up, indoor dining, retail, gyms, that sort of thing. Where do you stand on that now in terms of when it should be time to lift restrictions? Do you support doing that earlier or later, especially now that kids are back in schools?
So I will be guided by the measures that tell us about the COVID levels in our community and how the trends are going. They are looking good right now. We want that to continue, because the lower we bring it, the easier it is then to manage that level with our behaviors, with our public health actions. The wastewater still hasn't come down as much as we would like to see it, to the level in early December. So we're still watching indicators. And then we know we're all connected. So it does matter what's happening across the province, what's happening in Quebec. We want to take a look all around us as well as we think about the next steps. And certainly the province, is going to take the lead here around the plan for after the stay-at-home order, this 28 days comes to an end.
Thank you very much. We will now be going to Cassie Aylward at CFRA.
Hi there, thanks for taking my question. I wanted to just ask about the shelter outbreaks. Basically, there's just kind of been a lot of bouncing around back and forth between the city and the shelter. So I kind of just wanted to ask bluntly, if someone needs shelter tonight, can they get it? And how exactly do they get it?
Again, perhaps Donna, you could address that.
Yeah, thank you. So if somebody needs shelter, there is shelter available at the city should they need it. And what we have done is, and it's the same process that we would, pre-COVID, if somebody needs shelter, they call 311, and 311 passes them to what we call as a placement coordinator. And that placement coordinator existed even before COVID. And that assessment process that happens is to make sure kind of what is the need. And then what we would do is we would then place individuals in the appropriate facility. So what we've done in the COVID situation and to support because of the shelter outbreak situation is we have a variety of options that we use across the city. We use hotels, we've got rooms in the universities, we've got rooms in some of our community centers. So we really assess what is the need and what kind of supports they have around them, and then ensure that individuals are placed in that housing. And in addition to that, we can wrap around supports. We ensure that there's transportation if transportation is a need and somebody needs to get there to a shelter, or if they have a specific medical concern, or if there is a need to isolate, then we would refer them to the appropriate place to make sure that they can isolate safely as well, should that be the issue. So I think what the message that we want to make sure that gets out to the community is, although the current shelters have been impacted by COVID, it does not impact the ability to ensure that anyone in our community has a place to rest and sleep at night.
Thank you. And as a follow-up on the same topic, perhaps this is a question for Dr. Etches, but I wanted to know, Mr. DeMonte said in his opening that steps were taken before to try and prevent outbreaks and to prevent this from happening, but it has happened. So I'm wondering if any further steps are being taken to prevent this from happening again in the future.
I don't mind speaking to this initially, but obviously the operators and city partners are part of the approach. So for the duration of the pandemic, the basic measures in place are basic infection prevention and control measures, where the staff in shelters have been wearing masks and visors and washing their hands and keeping their distance and screening for symptoms. All of these things have been really relatively successful. I think we see, as the levels of COVID in the community increase, like the rapid rise we had after the holiday period, then the chances of it being introduced into any workplace increase. So we see that with long-term care homes. When the rate goes up in the community, it enters into long-term care homes because we're all connected. The people who live in the community work in the shelter, work in the long-term care homes. So this is what's happened. And then we, the enhanced measures we have now are to isolate people who test positive, and then to also identify their close contacts and make sure that they are self-isolating to limit any further transmission. And we also continue then through surveillance testing to be able to see what is happening to a better degree in terms of repeating through all of the shelters. We're looking at cycles of testing. And so that again allows us to continue that process to isolate and identify contacts. But the basic measures remain the same. The mask wearing, the protection for workers, those will limit the opportunity for transmission of COVID. I don't know if others wanted to add anything.
The only thing I would add to that is, when you look at how long we've actually been in this situation, and congregate living situations, have the highest risk, I think it really speaks to the our shelter system and their infection control practices, and the quality of the shelter systems that we have right now, that they've been able to maintain without having a significant outbreak. And I know my colleagues in many other municipalities have been much earlier into this situation, and we're confident that their practices in terms of addressing this current outbreak, that we will be able to remediate that and get the shelters back open again to be able to be at full capacity again.
Thank you very much. We will now be going to Eric O'Brien at City News.
Hi, thank you. My question is probably for Dr. Etches. Can you hear me? Yeah. Hello?
Yes.
Yeah,
Yes.
Sorry. Okay. All right. Sorry about that. So during the Ontario government's press conference last Friday, when talking about testing travelers coming into Canada, Christine Elliott also said that they would be looking at testing healthcare workers crossing the Ontario, between Ontario and Quebec. Did you get any clarity from the province on this?
I'm not aware of any specific communications on that, but my team might have. Perhaps we can follow up after the fact. I don't know of any specific guidance for the Ontario-Quebec border at this point.
Okay, yeah, probably a good follow-up on that. Now, I guess as a follow-up question, quickly, now that schools are open, the government said that they'd be implementing asymptomatic testing in schools. What rate could this be happening in, and how does that apply here in Ottawa?
So it's already started the weekend before school. We extended an invitation to about 10 different schools to participate in a trial of rapid testing, actually, combined with confirmatory testing for anyone who tested positive. That rapid testing, someone was mentioning to me, maybe it's helpful to clarify for people, it still involves a swab. There are different kinds of rapid tests out there. It's not just a sort of a spit on a paper one. But we are basically using that for people who don't have symptoms, where we want to assess if there could be more transmission than we're detecting, where perhaps there was an outbreak or someone who tested positive has a high number of high-risk contacts. So we'll be deploying increased testing where indicated. So it's not across all of the schools, but where it looks like it would be useful.
Great, thank you.
Thank you very much. Following Eric, we will go to Craig Lord at Global News.
Thanks very much. This is for Dr. Etches, I believe. The Ottawa Public Health reports on the lessons learned in long-term care homes and in general talked about the value that paid sick leave could bring to reducing outbreaks. I'm wondering, has OPH or yourself, Dr. Etches, have you been advocating to the province to implement paid sick leave, or what kind of communications have you had on potentially introducing supports like that?
I think I might start with that, if you don't mind, Dr. Etches. So Craig, that is in the report and will be a subject of discussion at the board meeting on Monday night. The board will discuss it, debate it, and determine how we want to proceed going forward vis-a-vis the board and the province.
Right, thank you, Chair. I was going to say the same thing, and just add that for these reports, the team has been living this pandemic for almost a year, and it was an opportunity to try to reflect. I was going to say pause and reflect, but they didn't pause. Reflect while responding on an ongoing basis, and think about what the experience has been, what have we learned, and then think about what would be useful to continue to address, and where some of those things can happen at the provincial level. So, these reports outline that partnership that we value very much. The communications that we have with our provincial elected members of parliament is been essential to inform us and help us as we go. And so this is, again, a way of communicating to the public as well as to our provincial partners about thoughts we have arising out of our experience.
Okay, as a follow-up as well, on the topic of reflecting, I suppose, early in the pandemic, we heard that the number of cases that were being reported by OPH were likely lower than the actual totals, about 5 or many multiples less than what's actually out there. At this point in the pandemic, how are we reflecting the accuracy of viral levels in the community, do you think?
It is still difficult for us to say exactly how many people out there are likely positive for COVID and they're not being tested. It certainly is more people than are probably being tested and testing positive. I think the last estimate I gave you, you just mentioned, it could be up to 5 times or so. We are, interested in trying to decrease that gap, because the public health measures work across the board. So for people who don't realize they have COVID, it's still going to be stopped in its onward transmission if people are wearing masks and keeping distance. That's the value of the public health measures. But it is helpful to identify COVID so that we can provide people with the right supports. If someone knows that they have COVID, there's a voluntary isolation center they can use to prevent it from getting to their family members. So I think that there's value in continuing to present and promote testing for COVID-19. You know, some of the other measures we could try to use to estimate what's out there, like the wastewater, they're just not calibrated like that yet. So we can't actually use that wastewater measure to say it's so many more cases or what's happened. We really can use that mostly still as a trend line. And what would tell us exactly what's out there is if we could do point prevalence, you know, widespread testing at one point in time of a representative sample, and that kind of research just it isn't planned right now.
Thank you very much.
Thank you very much as well. We will now be going to Joanne Loshes at Ottawa Citizen.
Hello. I want to get back to a question about opening up businesses, restaurants, and those kinds of settings. What sorts of data or indicators will you be looking for in order to recommend taking that step?
We're still using the monitoring indicators that are on the Ottawa Public Health dashboard that measure a few measures of how much COVID is in our community, how is our hospital system functioning, what about our public health response, and how's the testing system functioning. So those are the core aspects that we need to have strong and going in the right direction. Our wastewater is always an added in measure. We are interested at this point, of course, in what happens with schools and following the patterns in children who are tested for COVID-19 and their results. So that they're all public measures. So they're all available for everyone to look at, and you know, we'll have that conversation. You know, I think. In terms of as we go along, and we look forward to, of course, guidance from the province as well.
Thank you. And the follow-up question, we're hearing a lot about double masking. What's your opinion of double masking, and is it effective?
I know that there have been different reviews of evidence of which masks, how many layers, how many masks. My understanding is our team that looks at the science and has reviewed this is recommending the most important thing to do is wear a mask and then make sure it's tightly fitting around your face so that it's not gaping around your nose, around your sides of your face. Certainly 3 layers with 1 filtering layer is recommended, but 2 layers is almost as good. And we're not moving to a recommendation to use 2 masks at this point, rather to focus on wearing that mask and wearing it as recommended.
Thank you.
Thank you very much. Nous allons maintenant passer à Julien Paquette à le droit.
Oui, Docteur, je sais que vous avez mentionné dans votre mot d'ouverture qu'on n'était pas encore, on n'est pas encore arrivé au moment où on peut dire qu'on a aplati la courbe une fois de plus, mais force est de constater que les chiffres descendent de façon assez importante. Qu'est-ce qui explique, selon vous, qu'encore une fois, la Ville d'Ottawa, contrairement à plusieurs autres grandes villes, réussissent réussissent finalement, ou d'autres villes n'y arrivent pas, ou réussissent à diminuer les chiffres et à réduire la transmission de la transmission locale de la COVID-19?
Oui, c'est le travail de le peuple d'Ottawa. C'est dur, je sais. Ça inclut l'isolation des limites sur nos contacts, mais c'est les actions des gens qui fait une différence, de réduire l'opportunité pour la transmission de COVID-19. C'est possible que notre population a plus des opportunités pour utiliser ces pratiques au cause de le type d'entreprise, la capacité de travailler chez eux. Mais j'apprécie les efforts, c'est pas simple, c'est continu, c'était longtemps, mais nous avons les masques, les distances, et c'est efficace.
Parfait, merci. Puis, ma deuxième question, ce serait probablement pour M. Dimonte. La province, ce matin, a révisé, dans le fond, ses objectifs pour ce qui est de la vaccination des résidents de foyers de soins de longue durée. Je comprends que vous avez fait un petit résumé ce matin, mais de quelle façon la révision de ces objectifs, surtout au niveau de la date limite pour vacciner tout le monde, de quelle façon ça affecte la situation à Ottawa?
Je pense comme l'ensemble du territoire de l'Ontario, la révision a été faite parce qu'on ne dispose pas actuellement assez de vaccins pour rencontrer cet objectif-là. D'ailleurs, j'ai indiqué dans mes mots d'entrée que possiblement à la fin de la semaine, donc le 5 février, on va recevoir une nouvelle batch de vaccins. Donc, on ne peut pas rencontrer l'objectif si on reçoit le vaccin la même journée qu'on visait l'objectif. Je pense que c'est un peu ça qui fait en sorte que la date a été changée. Ce dit, je peux vous dire, à Ottawa, l'ensemble des vaccins qu'on a actuellement, on est en train de faire, comme je mentionné, les deuxièmes doses dans les centres de soins de longue durée, qui est une population très à risque. On veut complètement finir le travail à cet égard-là et on croit qu'on a assez de vaccins probablement parce qu'on en a reçu de Pfizer cette semaine, c'est-à-dire hier après-midi plutôt. Et donc, on recommence demain des autres foyers qu'on n'a pas complétés. Et pour le résultat, si on reçoit vendredi, samedi ou dimanche un autre batch, on va s'attarder à intervenir rapidement dans les résidences qui sont également une des priorités que le Dr. Etches et l'équipe a identifiées, parce que ces gens-là aussi sont à grand risque et l'équipe est mobilisée pour ça. Donc, simplement, Julien, c'est parce que la date a été changée, parce qu'on reçoit le vaccin à la date où ce que l'objectif a été, qui avait été prévu, et c'est une question de vaccin à cet égard-là.
Juste pour bien comprendre,
Oui.
clarifier, quand vous dites les résidences en priorité qui viendront, dans le fond, à partir de la semaine prochaine, on parle toujours de résidences, de foyers de soins de longue durée ou si
Non, les foyers de longue durée, on espère d'avoir complété. C'est la deuxième dose-là. Et maintenant, on rentre dans les résidences de personnes âgées qui ne sont pas classifiées comme résidences de soins de longue durée. On a une liste identifiée aussi qui sont prioritaires à cet égard-là. Donc, des foyers de personnes âgées.
Des maisons de retraite, dans le fond.
Oui, exactement.
Okay.
Oui.
Merci.
Plaisir.
Merci beaucoup, Julien. We will now go to Laura Egertson at Ottawa Magazine.
Hi, it's Laura here. Just wondering if you can just bring us up to date again on the latest number of doses you have received of the vaccine, or I think you still have not got any Moderna, but correct me if I'm wrong, and where you are in terms of the number administered.
So yeah, maybe I can start. I don't have the numbers offhand, Laura, so we'll certainly be able to send that to you. I don't know if
Mr. Dimonte, just to say, it's on our website. Now we have a dashboard, the same COVID dashboard that has the monitoring indicators. There's a tab for vaccination and testing. And it says that the doses we've received are 25,350. And the doses that we've administered are 26,337. And I'm sure you're going to say, what? How did you give more than 1,000 extra doses? That's because we have teams that have skill in drawing up an extra dose out of sun. And so as those numbers indicate, we've given everything we have and we're waiting on the next doses.
Thank you. So I know you said you expected you will probably get some more doses by the end of the week. I'm wondering if you can just go over with us again sort of the impact on your team of this delay in vaccination, because I know it's been, I'm sure, an incredible roller coaster for all of you of intense preparation and then having to sort of stand down a little bit.
So like everyone in this community, we know that this is the light at the end of the tunnel. We begin moving towards what Dr. Etches, the question she had, when we'll be returning to normal. This is another one of those elements, but most importantly, these populations, both in the long-term care and in the retirement homes, are those that are most at risk, where we've seen the most deaths and the most impact, serious impact of health impact. So the team has been mobilized and motivated to get them done as quickly as possible, because like everybody in this community, want to protect that population and then move on to other priorities. So yeah, Laurie, in simple terms, you know, when you have a team that's mobilized, that's so focused and so wanting to get this done, and then have to stand down because now we don't have the vaccine in hand, it is a little demotivating, because you know they want to get the job done. But that said, they're a great group of professionals. We've got a plan. They're ready, and at a moment's notice, I indicated, you know, within 24 hours when we got the go from Pfizer to be able to leave the complexity that we could leave the hospital with Pfizer and bring it to the long-term care. Within 24 hours and then 11, 12 days later, we had all the long-term care first doses done. So you can see the type of team and the professionalism that they have. So they're focused on the mission. They're ready to go. And so, yeah, this little pause is kind of frustrating, but it's the reality that we're all facing across the country, actually, with regards to vaccine. And as Dr. Etch has just pointed out, the team is so adept and so skilled that we're squeezing every last dose that we can to ensure that we can get the maximum number of people vaccinated. That's our priority.
Thank you.
Thank you very much. We will now be going to Taylor Blewett at Ottawa Sun.
Thanks so much. Both of my questions are actually for Dr. Etches. I want to ask, first of all, do you think we're adequately prepared to cope with the SARS-CoV-2 variants? Is there more that individuals and policymakers should be doing? And is there concern that our current protective mechanisms might not be as effective against the variants?
Thank you. The variants of concern are COVID-19 variants that could potentially be more transmissible. And that does mean we'd have to be a little more effective at our measures that control transmission. So those measures are the same. It is being effective with wearing masks, with keeping distance from others, and limiting our contacts. Those will work against variants, and we just need to make sure we don't have blind spots and use them. The other thing that I know the province has been working on is identifying the variants when someone tests positive. So they are working with the leadership of Public Health Ontario labs to be able to rapidly, after someone tests positive, then test for the variant in but the tools then that we use are the same in terms of contact tracing. So it's one of the tools that Ottawa Public Health has maintained throughout the response. At times of high numbers of people testing positive, we've had backlogs in being able to reach people who test positive and their contacts, but we've never let go, and we've always followed up with everybody eventually, prioritizing, of course, those at higher risk in different risk settings. There is a little bit more, there's a little shift around some of the measures for contact tracing when we're dealing with variants, in terms of how we identify the high risk contacts, monitoring for that period of isolation. There are a few little changes there in the policy approach, but the grand set is, it's what we have, what will work. We just need to apply it as strongly as possible.
Thanks. And how concerning is it to you that our vaccine supply is challenged? There obviously have been some disruptions, while variant cases have been identified in Ontario, as recently as yesterday, seeing the first case of the South African variant.
Well, we really have all been looking forward to a vaccine, and we were surprised that a vaccine was ready in December. We received vaccine within a year of the start of the pandemic. That's news, and of course now we want as much as possible, as soon as possible, to really protect the population with that tool. So that's what we want. The reality is it's not possible to get vaccine to everyone across the world all at once. And so, we do need to use those tools that we have. People in Ottawa have shown that they can do it, that we can use those basics of the masks and the distancing and visiting outdoors, with distance, and finding ways to connect socially, with video, with text. We've got to continue to support each other a little bit longer, but there is an end in sight.
Thanks so much.
Thank you very much. Nous allons maintenant passer à Catherine Moras à Radio-Canada.
Bonjour, Dr. Etches. J'aimerais vous entendre rapidement en français revenir sur le rapport sur les écoles qui est sorti aujourd'hui. J'aimerais vous entendre résumer les grandes lignes de ce qui est sorti.
Oui. J'ai mentionné que nous avons 2 rapports pour notre Conseil de la santé cette semaine prochaine, qui sont là pour partager nos réflexions, notre expérience dans cette pandémie et les idées pour améliorer certains aspects ou de utiliser notre connaissance de changer différentes approches pour l'avenir. C'est toujours un processus de partenariat avec la province. Nous apprécions beaucoup qu'il y a différents liens de communication. Nous avons des bonnes réunions régulières avec les députés provinciaux locaux. Et ces rapports, c'est une autre méthode de partager avec le public aussi notre expérience et les leçons et les idées pour l'avenir.
Quelles seront les prochaines étapes dans la distribution des tests rapides dans les écoles?
On va identifier les situations où c'est important pour nous d'avoir plus d'informations concernant la transmission de COVID-19. Par exemple, s'il y a une personne qui a un dépistage positif avec beaucoup de différents contacts dans les écoles, ça c'est une situation peut-être où on va utiliser le dépistage rapide pour les personnes sans symptômes. Si les gens ont des symptômes, on recommande le dépistage normal. Et c'est aussi peut-être il y a différentes situations où il y a plus haut risque dans la communauté autour de les écoles. Peut-être c'est une autre situation où on va utiliser une approche de fournir les dépistages près de les écoles avec les choix de les dépistages rapides ou normal.
Est-ce qu'on a déjà fixé des cibles en termes du nombre de dépistages qu'on veut faire par semaine?
Non, nous n'avons pas une cible comme ça, mais on va continuer avec le processus d'identifier les situations et apprendre. Par exemple, avec la fin de semaine passée, on a utilisé le dépistage pour je pense 10 écoles et on a eu le résultat que 2 étudiants dans 250 dépistages étaient positifs. Alors, nous avons trouvé c'est moins de le taux de positivité dans la communauté. Alors, on va continuer d'évaluer la valeur de cette approche.
Merci.
Merci beaucoup à tous. Thank you very much, everyone. This is all the time that we have. C'est tout le temps que nous disposons. Bonne journée. Have a great day.